Hello, my name is Nanette Garvin. I am currently a graduate student at Grand Canyon University pursuing my master's in nursing leadership. I am going to discuss my strategic plan to reduce 30-day readmission rates at Mayo Clinic. My objectives are to discuss 30-day readmission rates and how they are harmful to both patients and the healthcare system. I'm going to provide a strategic plan to improve 30-day readmission rates through improving the discharge process, discuss a plan for communicating the new discharge process and gain stakeholder buy-in, and provide an evaluation process for determining successes and areas for improvement. Mayo Clinic is a nonprofit healthcare organization with major campuses in Arizona, Florida, and Minnesota. The Mayo Clinic health system also has dozens of healthcare locations in several states. Mayo Clinic's current readmission rates are below 20%, which is below the national average. However, according to Mayo Clinic's mission statement, which includes providing patients with the best care possible, there is room for improvement. Mayo Clinic's mission statement is to inspire hope and contribute health and well-being by providing the best care to every patient through integrated clinical practice, education, and research. Why do we want to reduce readmissions? Because hospital readmissions are costly to both the patient and the healthcare system. Hospital readmissions increase the risk of patients acquiring a healthcare-acquired infection. Readmissions increase the burden on an already overcrowded healthcare system across the country, and the Centers for Medicare and Medicaid Services, or CMS, financially penalize hospitals for patients who are readmitted. The purpose of improving the discharge process is because proper discharge ensures discharged patients and their families receive education and understand how to care for themselves at home. An improved discharge process reduces emergency room visits and readmissions. Patients and their families are very satisfied with their care they receive if they are provided an effective discharge process. My readmission goal is to reduce 30-day readmissions by 2 percentage points by May 31st, 2017, and to improve hospital consumer assessment of healthcare providers and systems, or HCAHPS, failure rate by 8% by May 31st, 2017. My communication plan is to communicate the plan clearly and honestly with all stakeholders involved. Buy-in will be gained from stakeholders by using proper communication channels. Credibility will be established with stakeholders by exhibiting knowledge, expertise, and personal skills. Open communication will be used throughout the hospital to encourage collaboration across different departments. My implementation plan will first begin with a hospital administration making a clear and decisive statement regarding the importance of providing a safe and comprehensive hospital discharge. A leadership team of high-performing staff will be identified to aid in recognizing errors in current discharge processes. Current readmission rates will be identified for comparison. There will be identification of patients who are at an increased risk for readmissions due to their healthcare conditions and monitor them closely, and establish a care transition team to monitor patients in their homes after discharge. Current discharge processes will be revised to eliminate unacceptable practices which contribute to readmission rates. A new discharge process will be created. We will hire and train discharge educators with duties specific to the discharge process, hire and train staff who can perform follow-up phone calls after discharge, which has been proven to reduce readmissions. There will be a simulation of an after-hospital discharge plan and have a plan in place to measure progress of the new discharge process. Evaluation will be done through weekly and monthly meetings, which will be held involving discharge educators, frontline staff, implementation teams, and board members. Direct observation by discharge educators of the discharge process will be done. Data will be collected and reviewed from the Hospital Consumer Assessment of Healthcare Providers and Systems, or HCAHPS. Patient satisfaction surveys regarding the discharge process will be collected and evaluated. Frontline staff's feedback will be evaluated regarding the discharge process from their point of view, and throughout the investigation, thorough investigation will be done to the electronic health record to assess for specific reasons for readmissions and what can be done differently. I would like to thank all of you very much for viewing my presentation on decreasing readmission rates. I wish all of you the very best. Have a great day.